Joining us right now, Dr. Gil Mobley joins us. He's an emergency trauma physician in Springfield, Missouri. And by the way, you might remember him. He was the one who raised the red flags there about Ebola. He said the CDC is asleep at the wheel. And remember, he dressed up. Didn't you, Doc, you dressed up in the hazmat suit just to sort of illustrate the point. Kind of good way to get attention from the media. And I think it worked. Finally, people are paying attention.
On the back of that hazmat suit, it said the CDC is lying. But you know what? Either they're lying, they're incompetent, or it's a bad case of incrementalism, a drip, drip, drip of bad news, because they know we can't handle the truth, and we're still not getting it.
Well, today the CDC has now announced brand new guidelines for healthcare workers. They, of course, told us with the old protocols and guidelines that was sufficient and plenty to keep people from contracting it. Have you seen what the new guidelines are, and what is your response?
Well, thank God they're not telling the nurses to wrap tape around their neck. Thank God they're understanding that we really don't understand how this disease is truly transmitted, despite what the White House is saying. And I'm just absolutely astonished. You know, Thursday morning I woke up. It was the first day in months without horrible news until they announced Ron Klain, a guy that has no medical experience at all. And then all hope just dropped through the floor. You know, I even stopped to pause for a moment to wonder if this guy knows how to spell epidemiology.
Well, let me ask you this, though, Dr. Mobley, because, I mean, you're suggesting that that we're not getting the full truth from the government, that what they have told us, and we've had doctors on the air, we've had experts with infectious diseases, and they've said the basics. You can only contract Ebola through the direct contact with bodily fluids of a patient, and that patient needs to be in full symptomatic mode of Ebola. Do you know something or think something otherwise?
Look at what they're doing to the plane that 800 people rode on 5 subsequent trips after they realized that there was a person with Ebola on it. They're running after 800 people, spent $400,000, decontaminated it 4 times, and the NBC cameraman swears he caught it from a car he was cleaning. They're not being truthful. And let me tell you something. You know what's going to test the mettle of this guy Ron Klain? It's how long it's going to take for him to speak the truth about Ebola.
All right. Well,
and the truth is, we have lost the battle in Sierra Leone, we have lost the battle in Guinea, and we've lost the battle in Liberia. It is a hopeless situation. If you don't believe that, look at the PBS NewsHour last night, The Times. They are saying themselves, it is hopeless.
All right, so hold on a minute, because, you know, I am with you on one thing. I think it's maddening that the message seems to be so bungled here. And I do have questions about how they say, you know what, you're sitting on a plane next to somebody with Ebola, you're not likely to get it, and then yet they have to decontaminate the plane 3 times, and they're tracking everybody that was on the plane. I think that it's sort of confusing, the message that comes from that. But you are accusing the government of lying. What specifically are they lying about?
By saying they're preparing for 7 months, yet they let 55-gallon containers of hazmat material sit outside Emory University for a week of figuring out what to do with it. Yet they have nurses around the country groaning for protocols and procedures, yet most of the hospitals...
Well, those are mistakes. Those aren't lies.
They're lying saying that we're prepared and that anybody in any hospital just with a private bed can take care of an Ebola patient. Now we're realizing that all hospitals go, not us, we're sending them to one of the 11 level 4 containment centers.
So you're saying that when you say that the government is lying, you're specifically saying they're lying about the fact that they claim to be prepared and they are not.
Call it sugarcoating if you like, sir.
But you're not accusing them of lying about things like how the virus is transmitted, correct?
Sir, I think, like Robin Cook, he wrote the book on Ebola. He says he doesn't think anybody understands how this virus is transmitted, and I believe the scientists, not the politicians.
Well, if that were the case, Dr. Mobley, because we had Mr. Duncan, the guy who came here, lied about it and brought it from Liberia. He was symptomatic. He was in an emergency room first. He was sent home. He was around his family. He was around lots of people. The only 2 people who have contracted Ebola are the 2 nurses who were in fact, in direct contact with his bodily fluids. If it's passed in some other way, why don't we have more people with Ebola down in Dallas?
Because they're smoldering time bombs. They are bodies that are waiting to explode in explosive secretions and blood.
Wait, but
we could have stopped Mr. Duncan if we had followed him. You know, Frieden says no flight ban.
Hold on.
No flight ban because we can't follow these people.
Hold on, wait,
We're not following them anyway.
Doctor,
we need to quarantine these people coming from West Africa.
With all due respect, that means nothing. When you say they're smoldering time bombs, that means nothing. We have gone past the 21 days incubation period.
I'm talking about the 150 people that come in each day from West Africa.
All right, and excuse me, Doctor, take him down. Take him down. I'm not going to shout over this guy, but he's saying ridiculous things on the air that have no substances back up to it. So I will let you continue, Dr. Mobley, in a moment, but I need you to not change the subject. These smoldering time bombs you're talking about. I'm talking specifically about all of the people down in Dallas who were in contact with Mr. Duncan. Only 2 of them have contracted Ebola. They were, in fact, in direct contact with his bodily fluids. If you're saying that you can contract it in some other way, why don't we have more people in Dallas right now with Ebola?
Because we got him in level 4 almost containment early enough before he became that explosive time bomb of blood and secretions. That's when they become
Okay, so blood and secretions are bodily fluids.
And they are airborne. That's why the government changed the definition of close contact to standing 3 feet away. That sounds pretty airborne to me, sir.
Well, it's not really airborne technically in a scientific way because
by virologists, no, but you can catch it through the air. That means it doesn't have the gene to sustain itself for days in the air like the flu does, but you can catch it when they're hemorrhaging and coughing from 3 feet away, and the CDC knows it. Look at the doctors in the level 4 biocontainment. They're in scuba gear. They are in scuba gear, sir.
All right. All right. You know what? Do you have anything else? Because
No.
I'm done with them.
Yeah.
Fine. Thanks, Dr. Mobley. I'm sorry. That's just a bunch of histrionics that is meant to scare people. I think that if we can keep our wits about us and actually talk about the actual facts of this thing, we don't need to add this guy screaming things like ticking time bombs.
Listen, I am concerned about it. I'm not, but this is hysteria. And let me just say
that's exactly what we just heard was hysteria.
My real concern about this has always been that I don't think the messaging has been clear. And I think he has a point on that. But the rest of it, he seems to be just way outside the current thinking about Ebola.
We gave you your time, but we're not doing any justice or any service to our listeners by continuing that.